Getting a cancer diagnosis is an incredibly scary time. Moffitt Cancer Center was the first freestanding cancer treatment and research center authorized by the state of Florida. And now there is a new Moffitt Southshore Campus closer to us here on the Suncoast. Dr. Sarah Hoffe is a radiation oncologist, also the interim chair of the gastroenterology oncology program. She's here to talk about available treatments. It's great to have you with us.
Stephanie, thanks so much. Great to be here.
So tell us a little bit about the type of support Moffitt can provide after a diagnosis.
One of the most important things is making sure the diagnosis is correct so you can mobilize the team. So at Moffitt, we're all about a team-based approach. We're all about strategy. We're all about figuring out what can we do to get the patient the best treatment the quickest. Whether that's cure, or even in the cases we can't cure the patient, can we slow the cancer down to give as much quality of life as we can?
You specialize in GI and GI cancers and treatments. What is evolving in that world, and how are the treatments becoming more successful?
What's evolving in the GI cancer world is primarily figuring out how these therapies interdigitate together. It's an exciting time in GI cancers. We're evolving a new type of therapy called immunotherapy. And how does immunotherapy interact with radiation therapy, interact with surgery? For us, it's about strategy. What is best for that patient? Our job is to cure the patient if we can. So we have to figure out what is the patient's risk of having a cancer come back distantly in the body, and what is the patient's risk of having the cancer come back locally? And how can our team work together to get the best strategy for the patient?
We're hearing a lot about colon cancer, especially at younger ages. How is this something that Moffitt is able to look into and work with patients on so we can get, awareness that it's a problem?
Yeah, Stephanie, it's really a crazy time in colon cancer. We're seeing, unfortunately, younger and younger patients with colon cancer. And when a cancer is localized, it's in one part of the colon, surgery is very important. And so Moffitt now has a program where a patient who has a localized colon cancer can get in with 7 days. And that's because we think it's so important to get in to see our surgeons.
Yeah, no, that's great. And that certainly is good for peace of mind as well. All right, let's talk a little bit more about Southshore, because for those of us on the southern end of the Bay Area, it's very exciting to have a Moffitt location a little closer to home. What are some of the things that will be available now in Southshore?
The exciting thing about Southshore for us in GI, we have a full complement of GI services. So we have a GI medical oncology team, a GI radiation oncology team, and all of the exams that we do at the main campus, we can do at Southshore. And my patients have already told me how important that is for them, because the drive is cut substantially, so they just take that detour right off 75. They've already told me, very convenient, and they get all their imaging there. And remember, for a cancer specialist, we rely on imaging. And the Moffitt difference is I have an expert in that body part who reads that scan, and I rely on that completely. So having my patients get the scan at Southshore is huge to expedite their care.
Okay, so if I'm hearing you correctly, we'll be able to even do some diagnoses because of imaging at Southshore?
Absolutely.
So there may never be a reason to have to go up to main campus?
It all depends on the type of cancer it is. I will tell you, one of the most complicated cancers that we take care of are pancreatic cancers. We're a high volume center in Moffitt at pancreatic cancers, and really the imaging is key. Is it spread when it's diagnosed? Is it localized? If it's localized, is the bile duct obstructed? Does the patient need to have a stent placed? You know, the age-old thing where the patient comes in and they're yellow, i.e. jaundice. So really, time is of the essence. Getting the scan, our team of experts, we have 5 different specialty tumor boards. That's a lot. Let me tell you, for somebody like me, I go to all 5. That's a lot. But it's best for our patients, because then our patient's case is being reviewed by people who are expert in that disease.
Yeah, I mean, the expert care level is obvious. I think it's wonderful geographically to just take some stress off of patients. Obviously, travel is a lot. So if they can travel a little closer to home but still maintain that quality of treatment?
Yes, 100%. And one of the things, Stephanie, we try to do is when they go to have their imaging, they get their imaging, and then we might Zoom them with telemedicine a few days later. That way their husband can be home from work and they can be together when we're going over their diagnosis. It takes off that pressure of, oh, I have to have the scan and then I have to sit in the doctor's office. We give them time to relax a little bit in between, have their family together, and then we go over the scans.
All right. Well, it was wonderful to get an update on all that is happening in the GI cancer world. And in the Moffitt world, now a little bit closer to home with the opening of the Ruskin Southshore Campus. For more information about any of your concerns and specifically GI, you can go to moffitt.org/GI cancer.